Hi, thanks so much. Thanks for having me here today. My name is Elizabeth Buzney, and I work in Boston, Massachusetts, at the Brigham and Women's Hospital as part of MGB Dermatology. So what we see with EPP really stands in distinction to physical exam findings that we might see with other primary photosensitivity disorders. So, for example, with polymorphous light eruption or PMLE that we're all very familiar with, we see papules, plaques, and it's really itchy rather than primarily intensely painful. Solar urticaria, again, we're going to get wheals in response to light exposure. And so again, it looks very, very different than with EPP. Also, usually intensely pruritic rather than this deep burning pain. Again, chronic actinic dermatitis. With that, we're going to see eczema-like changes. We're going to see lichenification, and it's going to be very persistent, those skin changes. And then, of course, for example, lupus photosensitivity looks entirely different. Again, you're going to get that malar distribution, or with subacute cutaneous lupus, you're going to get scale or those other characteristic lesions with post-inflammatory changes as well. So again, EPP, very little in the way of skin findings during the eruption or afterwards, or I should say during the flare or afterwards. And then the second part of this is the pain characteristics, which are just different. So again, EPP has this intense, deep neuropathic-like pain, which is out of proportion to exam. The patients may say that they cannot continue exposure for another second. They have to get out of the sun immediately. Whereas other photodermatoses, there's typically itching. While there can be burning, it seems to be more rash-driven discomfort rather than this just severe, acute, unrelenting pain. And EPP pain, as I said before, can last hours to days, even after a brief exposure. And that's really unlike a sunburn, which I guess is another thing that we could put on the differential here. And EPP patients react again to visible light predominantly rather than just ultraviolet light. And with PMLE and urticaria, we more commonly see the photosensitivity to exposures in the ultraviolet range.